Over 71,000 people in Scotland have dementia. Alzheimer Scotland is Scotland's leading dementia charity and a leading force for change to make sure that no one goes through dementia on their own. We provide an extensive range of services, such as our 24-hour free-phone dementia helpline and our network of dementia advisors. As well as funding research into dementia, we also fund a unique dementia nurse programme. It is likely that many people with dementia will require inpatient acute hospital care at some stage of the illness. Unfortunately, this is often a difficult and distressing experience, as it was for the Duke and Duchess of Hamilton.
Lady Hamilton, when your husband was in the acute general hospital, how do you feel they handled his support and his care?
Accident emergency were excellent, but once he was in the acute ward, things changed. And this must be for all patients with dementia. Mm-hmm. They did not listen to what his requirements were. They would ask him questions which he was not capable to answer, instead of asking me.
I think you offered to stay in the hospital during the evening and the night, in fact.
Yes.
Yeah.
Yes, I was happy to stay. It was in a single room. There were a group of single rooms, so I wasn't bothering anyone. I would have been able to take him, get him a bottle and all the rest, the urinals, no problem. But unfortunately that was turned down, and he didn't get his sedation till after I left. And when I returned in the morning, they had a drip up, because he wouldn't drink, they said. And he also had an incident, which I presume was a fall. But that was recorded, apparently. None of that had to happen. My husband and I never used Duke and Duchess, but that morning, when I found him in that condition, I waited till the doctor came round and she said, "And how are things?" And I said, "Well, they're pretty bad. But this ward is going to go down as the one that killed the Duke of Hamilton. Is that what you want?"
The Duchess of Hamilton has called for improved dementia training for nurses and doctors. The 15th Duke of Hamilton was diagnosed with vascular dementia in 2006 at the age of 66. He passed away in June 2010.
We really want to try and, have a dementia nurse in every health board across Scotland, because I actually think that people don't set out to do a bad job, but the system that they work within doesn't seem to allow them to understand how to work with people with dementia and their families, and we've really got to try and tackle that. And do you feel that if we had a nurse in that hospital who was coaching the staff, helping the staff understand these issues, and perhaps someone for yourself to speak to, that would have made a difference?
Oh, I think it would be a huge difference. I mean, the nursing staff, once they realised how easy it could be, they were better.
We certainly think that nurses can do things differently, and it's not that difficult for them to do that, but what they need is a bit of help to understand how they might do that. And I don't think that people have really understood how many people there are in acute hospitals with dementia. And for example, in a 900-bedded unit, probably 150 people will have some form of dementia or cognitive impairment. So it's a really big problem, and it's never been properly understood.
Colin MacDonald is one of Alzheimer Scotland's specialist dementia nurses. He works with doctors and nurses to improve the way that people with dementia and their families experience the NHS.
One of the main things is firstly detecting when somebody has a dementia, increasing the detection rate, increasing the awareness among staff about what dementia is. Then we know somebody has dementia, we can then do something about it. It's then looking at education and training the staff, making sure that they're aware, that they're confident, that they've got the skills, the knowledge to work. It's also improving information about people with dementia in relation to their main carers, who knows the person best, and we're looking at information about how we can get that better, so when the person comes in, there's information that follows them. I'm now in a situation where we're now working more closely with the staff, and that's involved me doing a walk-around audit with 6 chosen areas. We're trying to develop 6 beacon areas in the hospital, so they're good practice areas. That involves me walking around with the charge nurse in the ward, looking at the audit, the environment, how can we make it more dementia friendly. It's also about working with the staff. I've given a leaflet to all the staff in all these areas so that I can be contacted at any time, 3 days a week, which is where I'm based here. And that's to give advice, support, information to the staff when they need it.
Sharon Caldwell is the manager of Ward 203 at the Royal Infirmary of Edinburgh. She's been working closely with Colin.
we realise there are certain areas that I think the Trust and the organisation as a whole have looked at that we really need to improve, work in partnership with the likes of Alzheimer Scotland, relatives and carers, with a lot of groups, because we can't do everything by ourselves. But areas within the ward in particular that we really need to focus on are looking at the patient's journey through here, looking at simple things. It's not rocket science that we sort of need. There are certain elements that need to be changed, like the environment, the lighting, signage in particular, orientation program. We need more clocks, simple things like calendars, altering our documentation. It's not just the skills and the process that needs, to sort of be looked at. It certainly does help. Having that expertise, that help there. Just the fact that there is somebody there on site. Our consultant nurse comes to us with a wealth of experience. He's certainly very knowledgeable. He's willing to assist in many things with us. He's willing to help with getting us he's actually listened to what our needs are, where we want to be, where we're hoping to go, and he's managing to help us work through that journey. The nurses know him, they're able to contact him, they're able to seek advice, and he's willing to come to the ward and actually deal with us with a patient there and then is a major bonus that we've never had.
Alzheimer Scotland funds each dementia nurse post for the first 3 years entirely from voluntary donations. After that, they're funded by the NHS board in which they're based. It costs Alzheimer Scotland up to £50,000 per year to fund each dementia nurse. There are currently 3 such nurses in posts funded by Alzheimer Scotland. The Duchess of Hamilton is spearheading a 3-year campaign to raise £1.5 million to place Alzheimer Scotland specialist dementia nurses in every Scottish health board.
You mentioned training, education, support before people get into hospital and support after it. But this part of it is a really critical component, and this is why this appeal is so important.
It's so important. It really is important. Angus used to say, if you've got 2 ears and 1 mouth, listen twice as much as you talk. And that was true, I think.
Lady Hamilton, can I thank you so much on behalf of everyone at Alzheimer Scotland. The amount of energy and effort that you've brought to this campaign, this appeal, is absolutely remarkable, and I'm sure we're going to make a big difference. You know our mission is to make sure no one goes through dementia on their own, and it's only through people like yourself helping us with that we will achieve it. But thank you so much.
Thank you.
Thank you.
Thank you.